this is Roger Green, host of the Surfing the NASH Tsunami podcast. Today, we are offering 5 conversations from episode 27, our preview of key sessions and abstracts at next week's EASL Congress 2023, plus a 6th separate conversation with Arun Sanyal and David Kleiner on the benefits of AI-assisted histopathology in anticipation of a major prospective study on the topic. This conversation includes Jörn Schattenberg, Ian Rowe, and me reviewing major sections of the EASL Congress program and also pointing to a few abstracts of particular interest. It starts with Ian stating that everybody's most awaited abstract will be the resmetirom results from MAESTRO-NASH that Stephen Harrison is presenting as the first presentation, GS1, in the first general session meeting. Jörn describes this presentation as, and I quote, the second watershed moment after the original obeticholic acid presentations of 2019. He also expresses the hope that we will see far more detailed safety data in this presentation, since safety data was obeticholic acid's perceived downfall. Jörn goes on to mention a poster, THU437, presented by a fellow in his program. It explores the health and quality of life burdens associated with patients with type 2 diabetes and advanced fibrosis, and, as one might expect, quantifies that burden is significant. The rest of the conversation covers 2 issues. My interest in OS29, a presentation given Thursday afternoon in the NAFL Diagnostics session that looks at analytical and clinical validation of AIM-PATH as a key tool in AI-based NASH assessment. I mentioned this paper because Stephen Harrison has teased in recent episodes that this technique, AIM-PATH, might meet the FDA criteria to replace ordinal histopathology at some point in the next few years. The second issue we discuss, the best use of all NITs, with best defined both longitudinally at what point in assessment or therapy, and in terms of what are we testing for. For example, level of disease versus source or site of injury versus how effective a given medication might be in regressing fibrosis or improving liver function. With major drug development presentations led by the MAESTRO-NASH results, new material on diagnostics from Litmus, Nail NIT, and others, and the nomenclature presentation, the EASL Congress will be 3 very packed days. We will be reporting twice on Saturday, once before the Saturday session and once afterwards, and I may attempt to post some one-on-one interviews on Thursday and Friday. So, when listening to this episode, think about what you want to attend in person or virtually, and just sit back, listen, enjoy, learn. When you're done, join the dialogue in our LinkedIn discussion group. This is a pretty simple episode. We've each selected several abstracts from the upcoming meeting that we think are of interest, and you've got the choice of either simply saying, here's what's in the abstract, or maybe not going through it in quite as much detail, but talking about why you find it fascinating. Because Ian is our guest, and we should be gallant about this, I will invite Ian to go first so that his first choice doesn't get stepped on. And we'll go back and forth for 2 or 3 rounds. We'll see what we come up with. And then, as I say, when we're done, Louise has her own contribution she made yesterday, and then we'll go on to the HistoIndex episode, which has no abstracts in it at all.
Jörn Schattenberg.
And you booked us for 3 hours, right? So we get all the shots at the abstracts we love.
No, I didn't do that. We're saving that for 6 o'clock in the morning in Vienna so that we can tape a live session while we're there. And with that, Ian, your floor.
Ian Rowe.
Yeah, well, you've really set us up there, Jörn, haven't you? We can all have an early morning breakfast with Roger in Vienna. So, which I'd be really looking forward to. It's an enviable task, isn't it, getting to go through the abstract book before a meeting? It's one of my favourite things to do because it gets you prepared and interested and ready to go to the meeting. And I don't think there's any doubt, at least in my mind, that the abstract that we're all looking forward to, or at least I'm looking forward to seeing, is the presentation of the MAESTRO-NASH data. I mean, that has to be the sort of jewel in the crown, and I sort of expect that we'll see the publication of the paper at the same time as we did do in the old days of hepatitis C, with presentations and publications being coincident. And although the top-line data have been read out in press release, it'll be really interesting, I think, to see a bit more of the data, particularly around the potential prevention of progression of fibrosis, stabilization. I know that we've talked about that on the podcast previously, about potential impact for patients, and in light of the OCA experience, a bit more about the adverse effect profile. I know we've seen quite a bit of that through the various Madrigal studies, MAESTRO-NAFL, that was presented several times over the course of the last year. But I think it's important to see that safety data accumulating and a bit deeper understanding of the efficacy endpoints. And I guess that there'll be a lot of excitement and interest around that presentation and I hope the associated publication.
And it's actually oral abstract 1 in the general session, so it kicks off the whole meeting and sets the scene.
Yes, that's exactly right, with all the appropriate attendant oohing and eyeing that one can expect to come as a result of that. I think that's exactly right. Ian, I'm not going to say that was cheating, but boy, was that easy. Jörn, why don't you go ahead next?
I guess there's a lot more you could say about that abstract. Well, I remember the Intercept data being presented. That was called the watershed moment, and I think this is the second big phase 3 trial, which is reading out, and the press release data was just even more robust. And after all the discussion about about, FDA efficacy, safety ratio. I'm very much looking forward to, also safety data that maybe wasn't detailed in so much depth. So clearly the presentation will go a little deeper there, and that's big excitement, But moving away from the general session opening abstract, I'm digging a little deeper into the abstract book, and you got to love your own stuff. Otherwise, you would not show it, right? So a fellow of mine is presenting a poster on Thursday. It's poster 437, and it's called Impaired Health-Related Quality of Life in People with Type 2 Diabetes and Advanced Fibrosis. And it's not rocket science, but it's an application on how we do medicine these days for patients with NASH. So we went out into 2 private practices, seeing patients with type 2 diabetes outside of the university system, and fibroscanned them, and then in addition assessed some questionnaires, health-related quality of life using the CLDQ, among other things, and enrolled 149 patients. The results are somewhat expected, but it quantifies the disease burden we have in those type 2 diabetes practices in Germany. Obesity and advanced fibrosis negatively impacted on health-related quality of life. It just reminds us how important the work is we're doing here, and that we want to offer to them something in the future. So that's a poster. If you're interested, stop by. Again, a very hands-on approach, screening and secondary care, patients with NASH and advanced fibrosis.
So thank you, Jörn. With that, I will split the gap between the first paper of general session and a poster on Thursday. First 2 things I want to talk about are oral posters, and this is OS 29, titled Analytical and Clinical Validation of AIM-NASH, a digital pathology tool for artificial intelligence-based measurement of non-alcoholic steatohepatitis histology. Before I talk about the paper, the reason I'm so interested by it is that Stephen Harrison, in each of his last 2 appearances on this podcast, has teased the idea that sometime in a reasonable time frame, FDA might accept AIM as a replacement for histology in terms of drug development. And I believe that this, although I've not spoken with him about it, I believe this is a pivotal paper in that discussion, in part because he's the lead author and the presenter, and in part because, for example, the background in AIM starts with a sentence that reads, the gold standard for participant enrollment and endpoint assessment in NASH clinical trials is manual histologic assessment of liver biopsy. This entire study is an effort to look at different kinds of reads and what happens when you use AIM-NASH for AI-assisted reads and independent reads. So the conclusion very simply says AIM-NASH assisted HPs are superior to unaided HPs in assessing NASH resolution. Histologic burden, everything, liver injury, the whole 9 yards. And the idea that these are consistent regardless of what any other form of test shows or any of those different measures. We're now starting to produce data that demonstrates that prospectively a histologic method can be superior in the kinds of things that I believe the FDA has been seeking data on. So I need to understand more about the paper than is in the abstract, but my sense is it is one of the linchpins for the question that goes, can we move beyond histopathology to AI-assisted or even AI-driven reads for admission or endpoint assessment studies, which, as we've agreed on this podcast for years, will be huge when it happens.
Yeah, Roger, I agree. I think this is an important abstract. It's actually in the Thursday NAFLD Diagnostics abstract session, and I have some more out of that session to be discussed. But I was reading through the abstract. I think I wanted to see some more data. Where's the data actually coming from? It's a big data set, 1,400, over 1,400 patients, and again, all these assessments. So I think the abstract didn't tell me everything that I wanted to learn from it, and I really need to see the presentation.
You're right. I mean, I couldn't tell exactly where the data was coming from, although it suggested, at least if you read the method where it says ground truth NASH CRN scores for clinical validation were determined via consensus by a panel of 3 experts, and then AIM-NASH was evaluated alone. I don't know where the data comes from.
Yeah, it's 3 clinical trials is what they say, 1,500 patients. It's probably phase 2 trials.
I'm looking at this now. You could probably infer, given that there are authors from Gilead, Novo Nordisk, and Bristol Myers Squibb, where the data might have come from.
Oh, right. So that's the stellar data set then.
Yeah. It's not as clear as it needs to be, I agree, but it's certainly, I think, an important planted flag on that particular hill.
Ian, did you see something in that diagnostic sessions you wanted to comment on?
It was a bit about the abstracts. I think the ability to include figures with abstracts, I think, is very welcome. The trouble is that people are putting more and more pretty pictures in, and it makes the abstract book harder and harder to read. But one of the big questions is about longitudinal assessment of biomarkers, and that's a study that relates to MRE, and that whole session looks really interesting, and I know that Jörn's going to expand on that in a minute. But looking at sequential measurement of biomarkers to see how progression on a biomarker impacts on future disease progression, I think it's one of the issues that we're still grappling with and understanding, how frequently tests need to be done and what magnitude of change in a biomarker predicts an outcome that is worse or indeed better.
Yeah, and just to say in that session and round it off, there's 2 abstracts that are going to be presented by Mazen Nureddin and Naeem Al-Khoury that are derived from the so-called NAIL-NIT consortium. Now, that's an interesting consortium I'm a part of because it combines data from completed clinical trials, the baseline data set at least. So for the NAIL-NIT, we combined 6 different data sets. And I agree, we didn't say which studies and trials they were in our abstract either, so can't complain about the previous one where they had 3. The 2 abstracts here is OS-0227, and it's the performance of vibration-controlled transient elastography in identifying at-risk NASH from those 6 clinical trials. And again, being embargoed, we shouldn't be discussing it online yet.
Jörn, I'm only laughing because from the title, it was probably my second choice paper, and then I saw it was embargoed.
Again, being a co-author, I've seen some of that, but it's not something to be discussed. Anyways, I think it feeds into what Ian said, that we're seeing more robust data sets of well-controlled, prospectively collected, closely monitored data on the value of NITs in staging the disease, cross-sectional, as it's done for the 027. The second abstract here is the one being presented by Naeem Al-Khoury, and it assesses the accuracy of the AGA referral pathway. So that will be very interesting too in the same data set. And again, as you said, Ian, I think the outcome prediction with the MRE is something that came from Japan, also raised my interest. And I think that's how we use NITs in the future, right? That's how we want to use it. We're going to use an NIT to stage the disease. We're going to use an NIT to come up with the indication for therapy. And then we use an NIT for treatment response. And it could be very different NITs. It's most likely not the same one. And it could even differ between MOAs, and at least when you're discussing treatment response. So this EASL Congress leads us one step closer to how we're going to be managing patients with fibrotic fatty liver disease. We should be saying steatotic liver disease also, Ian, I believe, at one point. And that's, of course, also something that's being discussed at that meeting big time.
Of course, then we're going to have to flirt with whether we have to rebrand this podcast. But that's a whole different headache that we will deal with after the event is over.
Well, from 5 to 10 on Saturday morning, I think that's the launch time. So you have to be ready with your new logo and tagline.
No, we're just going to stay with where we are for a while. We'll get through this meeting first, then we'll worry about it. But go ahead.
Thinking about how we use NITs in the future, there's an interesting abstract about prediction of outcomes post hepatitis C cure by transient elastography 1 year after treatment, which, although it's not directly relevant to NASH, it does give you a sort of window into that future prognostication with treatments. The treatments are very different, but it shows that those values retain prognosticability, albeit at less risk per given liver stiffness into the future. And there are some things that we shouldn't take from hepatitis C, I think, and that is the ideas about short duration curative treatments. But there are many other things that we can learn about how to select patients for treatment using prognostic tools, and indeed how those patients can be managed afterwards. I don't recall the number of that presentation, but it's the first authors, Georg Semler from the Vienna group, and I know that they are very much looking forward to hosting the meeting in their home city.
And now, back to Roger.
We hope you've enjoyed this recording. If you have any questions or comments about the content of this conversation or the entire episode, please put them in the review section of the page from which you downloaded this conversation, or send an email to questions@surfingnash.com. We hope to be back early or middle next week with a preview of the ADA convention in San Diego. We will clearly be back next weekend with a bunch of coverage at the EASL event itself. So until then, stay safe, surf on. We'll see you on the podcast. Bye-bye now.